This photo shows a modern ventilator screen in an intensive care unit, displaying a constant stream of respiratory waveforms and pressure metrics. To most of us, machines like this, or IV pumps or heart monitors, look like automatic plug-and-play appliances. You plug them into the wall, hook them up to the patient, and they do the work of saving a life. But the human body is an absolute nightmare of an engineering environment. It is not a clean, predictable laboratory. Biological signals, like the electrical impulses of a heartbeat, are inherently weak and buried in physiological noise. Furthermore, the physical properties of living tissue change constantly over time. In this diagram, you see a microscopic electrical current entering the body. The stakes for capturing weak biological signals are incredibly high. A leakage of 10 to 100 microamps applied directly to the heart can disrupt its rhythmic electrical pathway and cause a fatal microshock. Even if a machine is electrically safe, it has to survive its environment. The World Health Organization estimates that in some resource-limited settings, up to 70. To prevent systemic failures, biomedical engineers evaluate every piece of technology through a specific framework of 6 intersecting perspectives. We can see exactly how this works by breaking down one of the most common devices in any hospital, an automated infusion pump. Perspective 1 is clinical. The engineer starts with the exact medical need. Here, an anesthesiologist requires a continuous, highly precise delivery of a medication, measured down to specific microliters per minute. Notice in this animation how the mechanical pump's fluid flow interacts with a human blood vessel. This is perspective 2, engineering. The physics challenge is that the pump isn't pushing fluid into an empty pipe. It is forcing liquid against the dynamic, rhythmic back pressure of a living patient's circulatory system, which is constantly pushing back. Zooming inside the pump mechanism reveals perspective 3, electronics. To overcome that biological resistance, internal sensors constantly measure the flow rate and feed that data to microcontrollers, which carefully drive a stepper motor to maintain the exact dose. Getting a machine to physically push fluid into a vein satisfies the medical requirement, but that is only half the battle. The device still has to survive the hospital floor. Perspective 4 is software. The pump's algorithms must actively filter out biological noise, like the patient shifting their arm, to prevent alarm fatigue. The code ensures nurses are only alerted when there is a true blockage in the tube. Perspective 5 focuses on maintenance. If a clinical engineer in a rural hospital cannot quickly calibrate the pump or replace a failing part using accessible tools, the machine will inevitably end up in a storage closet. Finally, look at how this mechanical safety clamp snaps shut on a clear IV tube. This represents perspective 6, safety. It is the ultimate physical fail-safe. Even if the software glitches or the electronics completely short out, this clamp physically blocks a lethal overdose of fluid from reaching the patient. A mechanical pump only becomes a reliable biomedical device when it passes through all 6 of these lenses, ensuring it can actually be trusted with human life. Looking back at the modern ICU, the equipment surrounding the bed no longer looks like a collection of magic boxes. It is a dense, interconnected web of biological, mechanical, and systemic problem-solving. The biomedical engineer serves as the critical translator in this environment. They must fluently speak the language of a doctor's biological needs while understanding the absolute hard limits of the machine's hardware. As healthcare rapidly integrates artificial intelligence for diagnostics and continuous wearable sensors for at-home monitoring, this rigorous translation process becomes even more vital to patient safety. This 3D wireframe organ mirroring real-time data is what engineers call a digital twin. It allows researchers to virtually test how a new medical device will perform on a specific patient's unique anatomy, long before a physical prototype ever touches human tissue. Ultimately, biomedical engineering requires a highly specific mindset. They design responsibly and innovate constantly because they know that at the end of every wire, sensor, and algorithm, there is a patient relying on that math to survive.